Let's look at something else in the meantime. Health Minister Joe Phaahla has announced that children aged between 12 and 17 or teenagers will be able to access the Pfizer COVID-19 vaccine from next week, Wednesday. He says they are making changes to the Electronic Vaccination Data System to allow for a consent form that is suitable for the age group. The Children's Act does make it possible for children over 12 to give consent for certain medical procedures without their parents agreeing. To discuss, we're joined by an executive member of the South African Paediatric Association, Professor Mignon McCulloch. Thank you for being with us, Professor. Is this the right way to go? We know that the risk of death in the teenage age group is very low, although they can pass on COVID-19. How does this decision move us forward as a nation?
Thank you very much for having me. And we are just doing what the rest of the world is actually doing. So if you look at America, 57% of their 12 to 17-year-olds have now been vaccinated. And in Europe, France, Italy and Spain have had over 60% of their young adults also vaccinated. So you're right. If you looked at the global population, the older people are still more vulnerable, which is what we've said all along. But as more and more older people are now being vaccinated, we are now dropping the age group, as has been done, 60, 35, 18, now down to 12, because we know that children can get COVID. Teenagers specifically behave more like adults. And if children do get COVID, they are still 10 times more likely to be admitted than if they did not get COVID. So it is a risk for everybody. We also want our children to be back at school, not to be missing their exams, that we want them to have their lives back, to be socializing, to be doing sport. So many reasons for embarking on this. If you had to choose between a 60-year-old and a 16-year-old, you would still choose to do the 60-year-old first.
Yeah.
But we are now saying that the time has come that we've actually vaccinated a lot of our population, and it's now time to fall into what the rest of the world is doing and to vaccinate the teenagers. And in many ways, that will prevent them infecting their families and their communities as well. So,
what about the timing? You said yes, and everybody's saying it should be safe to write matric exams, but those are about to start. So there's always the small risk of a complication with a jab. Do you think the wisdom around the timing is good?
So we understand the anxiety. I mean, I think no virus has ever had as much anxiety around it as this virus has. And so we do understand people feeling anxious. We know that the side effects from the vaccine are on the whole pretty mild. So similar to adults, maybe a sore arm, maybe a bit of a fever, at worst a headache on the whole. And so we know that people who have been vaccinated will then have protection and have less chance of being admitted to hospital or becoming ill. We've also seen children develop what they call this long COVID, where you have fever and fatigue, loss of smell, and just complete exhaustion for 3 to 6 months afterwards. So that's been quite well reported from North America and from Europe as well. So we're trying to protect everybody. I think at the end of the day, we would actually like to get the entire nation vaccinated, and possibly this will become like the flu vaccine, where we get vaccinated every year. But we also want youngsters to have their lives back again. And I think it's been particularly difficult for youngsters not to be socializing. Matric exams are a big time when people are sitting in one room all writing exams together. So if we can prevent many outbreaks and many fourth waves or fifth waves, I think that would make us all feel a lot more comfortable.
All right, well, the big controversy, the big debate, should they be able to do it without parental consent? Could you weigh in on that?
So that's interesting, isn't it? And it started off from the UK, where they have something called Gillick competency, whereby if you are mature enough to understand what you're consenting for, then that should be okay. Obviously, we would like the parents and the children to have the communication together with the healthcare worker, and so that it is combined consent between both of them. But where you've got a parent who for some reason may be quite anxious about having a vaccine themselves, and the young person, 15, 16, feels that they really want to have the vaccine to protect themselves and possibly to protect their family who are scared to have the vaccine, legally they are allowed to give their own consent.
Yeah.
So we're not saying go out there and forcibly take consent from people. Obviously, we would want to have a good conversation with the parents and with the young people. But youngsters are much more mature these days, and the law actually says from the age of 12, if you have a competent adolescent and they understand what they are consenting to, then this should be the way to go. But obviously, we don't want to cause strife in families and cause lots of upset. But that is what's happening across the world.
So, and I'm not sure exactly of all the legalities around medical procedures, but you can make decisions as a youngster around other medical procedures, maybe even abortions, and not go and tell your parents. So you should be able to decide for yourself if you could have the jab or not.
And so the point we're trying to bring across as the South African Paediatric Association, and we in line with the American Paediatric Association and the Royal College in the UK of Paediatricians, vaccines are good, they're safe, they're out there to protect the whole community. We want to get our lives back. We want to get kids back to school, off the streets. A lot of kids have never, ever gone back to school. We want to get them to get nutrition, because a lot of them get nutrition, and get on with their lives and get their studies and their exams done. And in the same way, we want to keep our economies going. So there's been a lot of publicity about bad things about the vaccine. We're saying the vaccine is good and it's safe and it's what the population needs.
All right, and we'll see exactly what that consent looks like when the health department completes the process. Right now, the talk is that the teenagers will get a single dose of Pfizer. The health minister talking about the risk of myocarditis. That's why they don't get a second dose. Please give us the details of that.
So myocarditis is inflammation of the muscle of the heart, and we know that the vaccine has been reported to cause myocarditis in 20 of every million people that get vaccinated. COVID itself causes myocarditis in 450 of every million that actually get this infection. So we understand the concerns, but the myocarditis that has been reported to be associated with the vaccine, not necessarily caused by the vaccine, is fairly mild. It's self-limiting and it can be treated with paracetamol or Brufen. To date, no child has died of myocarditis related to the vaccine, but children have died from myocarditis related to the COVID infection itself. There's also this condition of the multi-inflammatory syndrome that some children have got as a result of COVID infection, and we're hoping that, and those children have ended up in intensive care and been very sick. So we're hoping that with a vaccine we can actually not only prevent myocarditis in a lot of children from COVID, but also the multi-inflammatory syndrome as well.
All right,
so
and government, let's just be clear, is keeping the door open to possibly extend this to a second vaccine. But for now, it will be one vaccine for the teenagers. Thank you, Professor. Great insight. We have to leave it there. Now, Professor Mignon McCulloch, Executive Member of the South African Paediatric Association.